would like to invite Dr. Ashraf Abdullah Saad from Sultan Qaboos University Hospital, Oman.
Yeah, hi. I'm not able to share my slides.
Why then?
Sorry?
What's the problem?
I will try. Just a minute. Give me some more time.
Okay. Dr. Abdullah?
Yes, I'm trying to. Can I send you my presentation to email, and then you open it for me?
Okay.
Okay. What's your email?
Let me type it.
Okay. Hello, hi.
Hello.
Yeah, I sent the email. Can you open?
I'm looking for it.
You found it?
Not yet. I'm looking for the. Where did you set it?
Just now. Cancer Science, sciencexevents.com. Is that your email?
Not yet. It's not mine. I'm looking for your.
I sent it to Anastasia. Anastasia
Okay.
Ryan.
Okay. Let's wait for Anastasia. You'll share in few minutes, few seconds.
Okay, can I start now?
Okay, it's okay.
Okay, so I will tell you to play next when I want the next slide. Is it okay?
Okay.
Okay, so I'm Dr. Ashraf, pediatric hematologist from SQH, Oman. In 2022, I wrote a review article on targeting cancer-associated glycans, and since then I have been invited to talk about it in conferences. So my presentation will talk about that. So please play next only when I tell you play next. Don't play next, please. Okay. Okay, we start. Okay, from introduction.
Can start, yes. Yes.
Okay, so the traditional methods for cancer treatment are the triad of chemotherapy, radiotherapy, and surgery. And despite the successes of these modalities, scientists were looking for alternatives or combination with other treatments, especially targeted therapies, because these three modalities were full of complications, and many patients also had treatment failure. So one of the modalities for targeted therapies was immunotherapy. Immunotherapy is basically harnessing the body's natural anti-cancer activity towards killing tumors, just modifying the immune system to kill tumors, and it led to an explosion of breakthrough of discoveries, and it achieved a great successes, especially when we talk about CAR T cells, which showed exceptional success in management of patients with hematological malignancies. But still, it has been, but still these therapies were not good enough in solid tumors, basically because of the nature of solid tumors and the tumor microenvironment itself. And also, that was also related to the these modalities, they have specific many things that hamper the effectiveness of these immunotherapies in solid tumors. plus also there was another pitfall of these immunotherapies, that they were targeting antigens that also co-expressed on normal tissues. So this led to many toxicities, a lot of toxicity that we called on target of tumor toxicity. This is because that these tumors were targeting protein antigens that are also expressed on normal tissues. Plus, we also have seen, because especially with the checkpoint blockade therapy, we have witnessed a new wave, new category of toxicity that we were not seeing with previous the previous therapies like chemotherapy, radiotherapy, and surgeries. So overall, immunotherapy was very good. It achieved a lot of successes, but still a lot of challenges are ahead, especially in targeting solid tumors, especially in targeting antigens that are co-expressed on normal tissues, and also a lot of toxicities. Please next. So as I have said, that even with these immunotherapies, a lot of patients responded, especially for hematological malignancies like leukemia, lymphoma. But still, there are a lot of patients who have not responded to these therapies. When I was a medical student, I was fascinated by the model of paroxysmal nocturnal hemoglobinuria. It is well known for hematologists. This is the triad of thrombosis, hemolytic anemia, and aplastic anemia of basically bone marrow failure syndrome. So paroxysmal nocturnal hemoglobinuria results from complement attack from the alternate complement pathway, because the erythrocytes lack complement inhibitory proteins. So I thought, why we cannot kill cancer with this with the complement system, especially that complement system is very strong soldier of the innate and adaptive immune system. Next, please. So in my concept, well, my theory was to exploit complement system to kill cancer. The complement system, as you know, that it ends up by forming the membrane attack complex, and I will show one figure. This membrane attack complex is like a pipe, like a hose that you insert it into the tumor and kill target cells. So I don't know why scientists still didn't think about utilizing the complement system in killing cancer. I found that the best way to exploit the complement system is through the lectin complement pathway, not the alternate complement pathway, the lectin complement pathway, because we cannot deprive cancer cells from complement inhibitory proteins without depriving other cell lines from these complement inhibitor proteins. So just to tell you, I thought that we should induce like a state of paroxysmal nocturnal hemoglobinuria in which cancer cells lack complement inhibitory proteins, and then alternate complement pathway will be activated. But that is not possible. So I found with all my research that the best way is to utilize the lectin complement pathway, especially that lectin complement pathway is being ignited, is being activated upon recognition of certain molecules which are called glycans. And when these lectins, which are glycan binding proteins, are they bind with the glycans, they activate the lectin complement pathway in conjunction and combination with certain enzymes which are called MBL-associated serine proteases, MASPs, which are 1, 2, and 3. Next, please. Play next. Okay, so then I found during my search that that cancer itself, during carcinogenesis, there is something called aberrant glycosylation, which has been recognized as a hallmark of cancer. So aberrant glycosylation will give rise to aberrant glycans, and these aberrant glycans will form a tumor glycocode, which is different from the normal cells. This can be targeted by cancer immunotherapies, and recently we are seeing this increasingly being utilized, as I will show you. Next slide, please. Okay, so the cancer-associated glycans there are 3 main changes found in cancer: glycosylation, which is basically truncation, silylation, and can you please play above? Increased complex ion glycans, silylation, and truncation. Okay, play next, please. So the changes you have seen in the previous slide will give rise to new antigens. Okay, these new antigens are immunogenic, and it can elicit immune responses. So it has been exploited in cancer vaccines and targeted therapies and antibodies and CAR T cells targeting new antigens. And play next, please. Play next. I can show you that there is like black here, black. Why it's black? Okay. There's CAR T cells now, CAR T cells, and this is a very good report. CAR T cells are targeting glycans for the first time, not targeting protein antigens as we know, CD19, like B cell, but targeting glycans. And this is very important discovery in cancer immunotherapy. Play next, please. Okay. So there are also many reports about targeting glycans for cancer immunotherapy. But my question in my publication, why not lectins? Because lectins are the natural glycan binding proteins which got created in our body. So we are not utilizing lectins in targeting glycans. And these scientists, especially Dr. Simone and Dr. Alina, they have started to work on this and to target cancer-associated glycans, like I see in the middle, GB3. This is a glycan targeted by lectin CAR combination, and it was effective in colorectal and triple-negative breast cancer. Play next, please. And by the way, I just want to say that these glycans are aberrant glycans are very specific tumor antigens. Targeting them will not cause toxicities as in other forms of cancer immunotherapies like antibodies, which target the protein antigens. As you can see over here, that the explosion of we have recently seen this since 2020, and now many reports about targeting glycans by antibodies, by chimeric antigen receptors, lectin combination, and etc. Next, please. Next. So my theory is my theory in brief. I am not I am to the scientists already started to target cancer-associated glycans. Why? What I am different from is that I am seeing that why we are not utilizing the body's why not imitate our body in a human body in our body there is something called non-binding lectin which bind to MASP, which is the enzyme, and this activates the lectin complement pathway. So I propose that that we can target these cancer-associated glycans by administering a lectin, which is specific for these aberrant glycans, in combination with protease. Protease is the same as MASP, and these should be linked with a linker chemically, and they can activate the complement cascade, which can lead to profound activation of the complement cascade, ending up by forming the membrane attack complex, which can kill target cells. Next, please. And by the way, even administering natural lectins, even without a protease, can activate the lectin complement pathway by forming a pressure into a pressure. Next, please. Next slide. Yes. So it can form a pressure, and it can kill target cells. So this the previous slide and this slide, I'm showing to you that studies and new research about novel lectin technology, which is called lectin engineering. It can be in the form of recombinant recombinant DNA technology. It can be in other forms. There are many chemical forms of lectins. So the lectin engineering is now possible. It is not something which is impossible, and we should utilize it against cancer. Next, please. Okay, and even the protease is an enzyme which can be synthesized chemically, and recombinant protease, which is like MASP2, is manifold stronger than the natural MASP2, which binds to the natural lectins. So what I am thinking is feasible and possible. Next, please. Okay, from lessons learned from virology, viral glycosylation has been investigated to consist of number of enveloped glycoproteins, because viruses exploit and manipulate the host glycans for tumor, for something called molecular mimicry, to shield themselves. Like coronavirus, they shield themselves by glycans, so the immune system will not be able to attack them. Next, please. So the virology has preceded oncology in exploiting these lectins. Many natural lectins identified in bacteria, plants, algae have been reported to have antiviral activity, and some of these antiviral lectins have been also utilized as anti-cancer lectins. Therapeutic potential of host and natural lectins as antiviral agents, the development of molecularly engineered antiviral lectins that target virus-associated glycans. So in a similar way, we can target cancer-associated glycans. Engineered lectins were broadly effective antiviral agents, either directly by binding to glycans of the viral envelope, leading to blocking virus entry, or indirectly by forcing pathogens to mutate or delete their protective envelope glycan shields. So this is a very effective killing method. Next, please. Recently, this lectin was taken from banana. It has been shown to be very effective against influenza and also against COVID-19. Next, please. And even this ban-lectin also have been shown to be effective against cancer, as I will show you. Next, please. Okay, so you can see here novel banana-lectin CAR T cell to target pancreatic tumors. So that antiviral banana-lectin was combined with CAR T cells, and it was effective against pancreatic tumors. And I am sure that even this banana-lectin itself can be effective to target to kill pancreatic tumors, especially if conjugated with a protease that will activate the complement pathway. Next, please. So this is my article. Please go and search for it and start reading it. It will summarize. It will show you how I was thinking. I started to talk about leukemia, but then I felt myself delving into an ocean of glycobiology and oncology. So I was talking about also solid tumors. Next, please. So this is my theory. So the lectin will be bound to protease through a linker. It will activate the complement pathway, ending up by forming this one membrane attack complex. It will insert a hose and lead to lysis of target cell with a virus, with a cancer cell. Next, please. Well, this is the classification of cancer-associated glycans formed by aberrant glycosylation. Next, please. As you can see here, like global breast cancer cell, this is one of the antigens which can be targeted by cancer immunotherapy. Here, GB3, many cancers, lymphoma, breast, ovarian, colorectal, pancreatic, etc. Next, please. This is all present in my article. Next. These are additional antigens. And you can see here also breast cancer, 9OC-GD3, many antigens and many cancers. Next, please. Even the enzymes which reduce these aberrant glycans are increased in certain cancers, and they give rise to TACAMIS aberrant glycan, a tumor-associated carbohydrate antigen. So these also antigens can be either targeted directly, or these enzymes can be targeted also, these enzymes. Next, please. Okay, and this is some of the glycoproteins we know as cancer biomarkers, and they are actually glycoproteins and plasma glycans. Next, please. This is the end of my presentation. Please follow me on Twitter. I launched this move, research in fantasy until fantasy becomes a reality. And it's not only for me, it's for any scientist. Actually, I'm not a scientist, I'm a clinician, but I like to motivate people to search and with the aim, hopefully, that one day will eradicate cancer from this world. This is the end of my presentation. Thank you.
Thank you very much, Dr. Ashraf.